Today we are going to practice suturing a second-degree laceration on our foam block, and I'm going to step you through how to do this. Before you begin practicing repairs of the vaginal mucosa and perineum together, it's important to recognize the angles at which you'll be suturing, and this is why the foam block is really handy. The planes of the vaginal mucosa and the perineum meet at a right angle. The vagina is the horizontal angle here, and the perineum is the vertical angle, and they meet here at a point. This point along here is the introitus. The black line represents the hymenal ring. The other thing I want to make note of is that I'm going to go over just the general principles of doing this repair. However, you'll see a lot of differences amongst providers and different preferences, and that's okay. There are lots of differences in how to do this, but the general principles should remain pretty consistent. So at first, I've already started out here with some stitches already on. You will see that I'm doing the locked running stitch along the vagina. I have begun the repair with an anchor stitch about 1 centimeter beyond the apex of the laceration, and that is because some blood vessels will retract within the mucosa and submucosa of the vagina, and so in order to gather those up, you start your repair beyond the apex. So it's about 1 centimeter beyond the apex where I did my anchor stitch and tied it off and did a few locked running. We'll continue our locked running along the vagina. However, at this point, most providers will stop, set their needle holder down in their needle, and use your finger to kind of explore and feel for dead space underneath the stitches that you've put in place. And if there's a lot of space underneath, if you could reach back in there and go down underneath those stitches, then you'll want to do some deep interrupteds. This is where your deep interrupteds come into play. Some providers will put in those deep interrupteds prior to beginning. Others will go ahead and begin the locked running stitch and do a few stitches and then stop and feel for what we call dead space. If you can feel your finger, enough space for your finger to fit in underneath those stitches, then you'll need to put in some deep interrupted stitches. You would get a new needle and thread suture using a 2-0 vicryl or chromic and put in your deep interrupteds at the horizontal plane. You would be able to visualize underneath the stitches where you would need these to go. Take a bite in, going around both sides to gather it up, and tie that off using an interrupted stitch. You would not go vertically for fear or risk of going into the rectal mucosa or rectal muscle. So instead, you do your deep interrupteds on the horizontal plane. You would tie those off individually and then resume your locked running stitches with your original suture. So at this point, we're not going to put in deep interrupteds. We don't need those for this repair. I'm going to go ahead and continue my locked running stitches all the way to the introitus. You'll see here I am close to the hymenal ring. I could probably fit one more stitch in there, but I will not do so because now I am going to go ahead and switch planes to work along the perineum. In order to switch planes, I'm going to enter the vaginal mucosa with the needle and come out on the same side within the perineal submucosa. If you accidentally lock a stitch, it's perfectly fine. That happens a lot. And you can just unlock it by bringing your needle driver through the loop, how you had locked it. That happens a lot. And now I'm going to be working within the perineum. And I'm going to do a running stitch down the submucosa of the perineum. So now you can see I'm no longer working along the horizontal plane. I'm going to be working along the vertical plane. And I'm going to put my stitch in directly across from where I placed the stitch. I'll bring it out along the other side of the laceration. You can see my first stitch along here, the diagonal, and about a centimeter down. I'll go ahead and put in my second stitch. And now I'm going to put in one more stitch here. Okay, so now you'll be able to see the running stitches along the diagonal here. Now I would try to go as close to the apex as possible of the perineal laceration. However, I don't want to risk going into the rectum. So for our purposes on the foam, I'll go ahead and begin my subcuticular stitch now. The subcuticular stitch is more superficial than the running stitches that I did along the submucosa. Now along the subcuticular stitch, I'm going to be just under the layer of the skin. And remember, this is like the zipper stitch that will zip up the layer of the skin just underneath the surface. Remember, we want no knots and no sutures along the perineum, along the skin. We want no sutures or knots coming over the introitus or hymenal ring as well. Okay, so this is a pretty long perineum. In real life, a perineum is not going to be quite this long, so at most you're going to have 2 or 3 stitches coming up here. And now I need to switch planes again, so I am going to work from within the submucosa of the perineum, and I'm going to go on the same side. I'm going to go in and then up on into the vagina. Okay, and I'll demonstrate how we do that. It's the exact opposite of what we did coming down at the beginning of our repair when we came down from the vagina to the perineum. Now I'm going to go back up from the perineum to the vagina. And I'll demonstrate this so you can see it. I'm holding open the foam so that you can see it. I would go in, and it doesn't matter which side you do, it's fine. Go in on the perineum and up into the vagina. Okay. Okay. And now I am back up in the vagina, and you can see no stitches or no knots will be present along the introitus or all through the perineum. And now this is my final stitch. I left room here in the vagina for one more stitch. And this doesn't matter if it's locked. This is just our final stitch to anchor off the whole repair. And since we're at the end of our repair, we can go ahead and clip off the needle. And I would do that for safety. And now you have your loop on one side and your tail on the other, and you would tie that off however you wanted, as an instrument tie or with your one-handed or two-handed, to complete your repair. And that's the end of the second-degree laceration repair.